It is often said that dreams are like fleeting clouds or transient like the morning dew. But there are chosen few who firmly believe that with the right amount of willingness, determination and vigor, dreams can also be made to come true. Anand Hospital was a dream of two souls who not only dared to dream big, but dared to put their dreams into reality. Hari Om Anand and his wife Meena Anand nurtured a dream of giving the citizens of Meerut a healthcare setup that would not only have the state-of-the-art infrastructure, equipment and doctors, but one that would be committed to offering the healing touch with care and compassion. In this ambitious venture, the enterprising couple was backed by a dedicated team of directors and professionals who helped in mobilizing resources and technical inputs. Their arduous efforts, combined with meticulous planning, did not go in vain. On 29 August 2007, Anand Hospital was born.
We believe in not just curing, but healing the patient.
Yes, we believe in not just curing the patients, but healing them as well. We heal through technology. We heal through excellence and expertise. We heal through compassion. And we heal with urgency. Anand Hospital has put Meerut on the national roadmap of healthcare. It is one of the first and most comprehensive multi-speciality setups in Western UP with the latest state-of-the-art equipments for both diagnostic as well as therapeutic services under one roof, and has the potential to develop into a rare center of excellence and dedicated service to humanity. You all know that Meerut has always played an important role in the field of medical science and healthcare delivery in Western UP and Uttarakhand. However, for a long time, need was being felt for a tertiary care center. From this point of view, Anand Hospital is a landmark achievement in the medical field in Meerut. It is one of the first comprehensive multi-speciality setup of Western UP. The 150-bedded hospital is centrally air-conditioned. Earthquake-proof, well-equipped with firefighting equipment. Uninterrupted power supply, and to match the modern standards, the entire hospital is linked with a centralized computer network. Emergency is the mirror of any hospital. Our super specialization in orthopedics, neurosurgery and gastrosurgery, three of the most needed disciplines in trauma, gives the hospital the ideal means for trauma management. The emergency room has a team of well-trained intensivists and well-equipped triage and observation sections. This enables the team to perform critical, life-saving procedures straight away in the emergency room at any given hour. An emergency, such as trauma caused by accidents, is a major focus area of the hospital, where prompt and specialized attention is given in order to save precious lives. For any accident and emergency, the hospital's 24-hour ambulance service is always on call with an emergency hotline number of 0121 266 6611. An act of kindness may not change the course of history, but if it can change the course of someone's life, it is with it. Intensive care units symbolize the high point of technical advancements in medicine. Such units integrate varied specialties and diverse technologies. It is thus apparent that the role of critical care services is vital and crucial to a tertiary care hospital, as critical care units contribute enormously to the survival of acutely and critically ill patients. The critical care unit of ICU at Anand Hospital is a center of excellence in its own right. Anand Hospital has specialized ICUs and neonatal ICU. And a pediatric ICU. The neonatal ICU is well equipped with a microprocessed radiant warmer. A modern double-surface CFL phototherapy. A bubble CBAP, ventilators, surfactant therapy, and peritoneal dialysis, exchange blood transfusion. Critical Care Units, CCU. To give a new lease of life to critically ill cardiac patients, the hospital has an intensive coronary care unit with advanced monitoring and life support systems under supervision of a capable cardiologist, along with attending resident doctors. Facility for emergency temporary pacing and invasive cardiac monitoring in critical sick patients is also available. OTs, Operation Theatres. The hospital has 6 of the most advanced operation theatres in Western UP. The state-of-the-art operation theatres are edgeless, with laminar flow and HEPA filters to eliminate chances of any infection. It is said that a good surgeon must have an eagle's eye, a lion's heart, and a lady's hand. The operating manners of these doctors shows the same. Outpatient departments, OPD. The hospital also has a round-the-clock functioning multi-speciality OPD with the most reputed specialists and super specialists rendering their services. Imaging and diagnostic facilities. The hospital firmly believes that the more accurate the diagnostics, the better the treatment. And to achieve this, they have the most advanced equipment to ensure the best possible accuracy. The other diagnostic facilities available include a highly advanced multi-slice CT scan with minimal scan time and radiation to patient, ultrasound, digital X-ray and mobile X-ray machine. non-invasive cardiac lab with TMT, echo and Doppler study. Neurodiagnostics like EMG, EEG and NCV. Pathology. The hospital possesses one of the most sophisticated pathology labs in the region with fully automated clinical chemistry analyzer, automated hematology analyzer, radiometer blood gas analyzer, and random access immunoassay analyzer. Blood bank. The hospital is proud to have one of the most modern blood banks of the city, equipped with component separator and plasmapheresis. The backbone of any hospital is the Department of Internal Medicine, and Anand Hospital has a team of very experienced and accomplished physicians who provide treatment to patients suffering from various infectious diseases, hematological diseases including bone marrow aspiration and biopsy, emergency services for various medical problems including poisoning etc. are also available. The hospital also has a team of experienced and well-trained gynecologists and obstetricians who are well equipped to provide antenatal services to high-risk pregnancies, family planning services to women of all age groups, and infertility evaluation and management. All types of laparoscopic, hysteroscopic and open surgical procedures are being offered. The team of general surgeons at the hospital is there to perform all types of general and laparoscopic surgical procedures. The team is specially geared up to provide emergency and trauma services round the clock. The hospital also has specialized proctology clinic. There is a department of neurosciences investigating and treating diseases affecting the brain, spinal cord, muscles and nerves. Thrombolytic therapy for stroke, treatment of epilepsy and various muscle and nerve disorders is also available. The hospital has specialized services for cranial surgery, spinal surgery and endoscopic surgery for brain and spine. The Department of Renal Sciences, the nephrology unit, has advanced treatment for acute and chronic renal failure. It has facilities for hemodialysis, peritoneal dialysis and continuous renal replacement therapy is also available for the first time in the Western UP. The urology department is headed by a dynamic surgeon who is covering both endocrinology and advanced open urological procedures. The Department of Gastrosciences and Hepatology has the good fortune of having a team of an experienced gastrosurgeon and a dedicated gastroenterologist. The gastroenterology department is offering a whole spectrum of diagnostic and therapeutic endoscopic procedures, including ERCP, colonoscopy, etc. The Department of Surgical Gastroenterology is involved in managing major GI surgical problems which predominantly include GI cancers, hepatobiliary and pancreatic diseases, colorectal surgery and minimal access or laparoscopic surgery. The right kind of orthopedic care can make a significant difference in terms of sustaining or rejuvenating the quality of our life. A team of highly skilled, broadly experienced orthopedic surgeons is there to provide the latest in orthopedic treatment and surgical techniques, including major joint replacements, arthroscopies, etc. The Department of Respiratory Medicine is offering both diagnostic as well as therapeutic bronchoscopy, sleep study, and sleep apnea management. The Thoracic Surgery Department is headed by an enterprising surgeon who is not only performing open thoracic surgeries but also offering latest video-assisted thoracoscopic surgery. The Department of ENT, apart from performing routine surgery for sinus, ear, nose and throat, is also offering diagnostic and therapeutic endoscopic surgery. The Plastic Surgery Department, headed by a skilled surgeon, is offering complete range of corrective, cosmetic and microvascular surgery. The hospital has a complete setup of a physiotherapy department equipped with laser therapy, SWT, computerized traction IFT, etc. The Department of Dermatology has both ND-YAG laser for hair removal and CO2 laser for removal of warts. It also has PUVA (PUVA) ultraviolet therapy for treatment of psoriasis and leukoderma. The Department of Holistic Medicine, which in other words is the soul of this hospital, not only offers psycho-spiritual counseling, yoga and meditation, but also concentrates on alternative therapies like homeopathy, acupuncture and Ayurveda. An in-house kitchen managed by trained dietitian is there to provide all the meals to the hospitalized patients.
Building and infrastructure are no doubt important for the healthcare program, but more important is the commitment of the doctors and the healthcare team.
At Anand Hospital, our mission is not only to provide high quality medical care, but to show